and welcome to the 65th Bi-Monthly Breastfeeding Coalition's webinar. I'm Danae Hartfield, the Senior Coalitions Relations Coordinator at USBC, and I'm so glad to have you join us for today's session. This series is jointly hosted by CDC's Division of Nutrition, Physical Activity, and Obesity, and by the USBC. These webinars, referred to as the 222, are held on the second Tuesdays of even-numbered months from 2 to 3 p.m. Eastern Time. And the purpose of this series is to bring together breastfeeding coalitions to share best practices and news, and to network and collaborate on issues of national significance. Coalition members and breastfeeding advocates from around the country can join us for these free webinars. Webinar announcement emails are sent through USBC's Coalitions announcement list 1 to 2 weeks before each session. If you're not subscribed to this announcement list, we do invite you to visit the Coalitions Learning Connection in the USBC website, where you can subscribe to this forum to receive key updates and announcements from USBC headquarters. Topic and speaker details can also be found for this webinar on its public page at www.usbreastfeeding.org/coalitions-webinars. As you know, we've streamlined access to this series, so you only need to register once to have access to a full to all future sessions. Once you're registered, you'll receive reminders from the GoToWebinar system with your unique link to join each session. Slides and handouts for today's session can be found on the 222's public webpage, and the link has also been chatted to you. We understand that not everyone can make it to our live session, so we do record all of the webinars, and you'll be able to find the recording of today's session on the public webpage as well as in the Coalition's Learning Connection with the other archived sessions. And here's how to navigate to that public webpage. So simply go to usbreastfeeding.org and then hover your mouse over the Coalitions tab, and you can either select the Coalition's Learning Connection or CDC-USBC bi-monthly webinars. For today's session, all participants are in listen-only mode. We encourage you to chat your questions to us throughout the presentation, and we'll be sure to read them off to our presenter during the Q&A session at the end of the presentation. And here's how you chat questions. Just go to your GoToWebinar control panel on the right of the screen. If you don't see it, it may be minimized. Just click on that orange tab and it should pop back out. If you scroll down below the audio section, you should see a tab for questions. When you click on it, it'll open up and you should be able to type in your question. If you have any webinar-related problems, please send an email to coalitions@usbreastfeeding.org, and one of our staff members will be happy to assist you. And that brings me to today's session. Empowering local leadership and coordinating breastfeeding messages by catalyzing quick wins. Michigan mothers and breastfeeding service providers have declared loudly and clearly that inconsistent information is a barrier to achieving optimal breastfeeding outcomes. The Michigan Breastfeeding Network is on a quest to meet this challenge head-on. They are empowering and expanding their local coalition network through the 5 conditions of collective impact, putting specific emphasis on empowering local leadership with quick wins. Their focus is on providing coordinated and easy to implement tools, fostering a culture of idea sharing, and helping local leaders to stop reinventing the wheel. Today, our presenter will share about their successes, lessons learned, and opportunities for the future. I am delighted to introduce our presenter for today. Shannon McKenney Shubert believes in the power of communities to bring about a large-scale change. In her roles as Project Director for the Michigan Breastfeeding Network and Chairperson of the Wayne County Breastfeeding Coalition, Shannon works to break down barriers to optimal breastfeeding. She earned her Master's in Public Health Management and Policy from the University of Michigan and has previously served as Chief of Staff for Co-Effective, WIC, and Breastfeeding Programs Coordinator for the CHAST Center, as well as Policy Consultant for the Nemours Office of Child Health Policy and Advocacy. And with that, I am going to turn it over to Shannon.
Thanks, Danae, and welcome everybody. I am so excited and honored to be here with you today. I have been a participant on these webinars for a long time and have found them so incredibly useful in the work that we do. It's a real honor to be sharing with you some of the work that we're doing here at the Michigan Breastfeeding Network. So let's dig in. I will tell you some of the goals we have today. These are pretty overarching, but I hope that you'll keep them in mind as we talk through the presentation today. The first thing is I really want to share with you what we've done in an effort to empower you with strategies that we've used, and use this as a way to get kind of your creative juices flowing, thinking about the way that you can do some of these things and take these strategies back to your own work. And I also really want to use this as an opportunity to start a conversation. Like I said, I have attended these webinars in the past and have used them to build my own professional network of other state coalition leaders, and you'll see throughout the presentation today how that's really advanced the work of the network. So I'm sharing my email address at the end of this, and I do hope that this will just be the start, and that if you're really inspired by some of the things that we talk about, or motivated to do something in your own community, or want to just share feedback, I really am hopeful to be a resource to all of you in an effort to pay it forward. So just a little bit about the Michigan Breastfeeding Network to kind of give you some context for the work that we do. We've had a long informal existence. Like many of the state coalitions around the country, we worked for a long period of time just as a really dedicated group of volunteers. But then in 2012, we formalized. We became a 501c3 and actually hired the first staff person for the team. And since then, we've really expanded our work. We've gone from just a few projects to actually, right now, we currently have 9 active projects, and we have a what we consider a pretty agile team of between 6 and 10 staff at any given time, and a 9-member board of directors. It is a total powerhouse in the state of Michigan, and I'm really honored to serve alongside them. Our mission at the network is really 3-pronged, and it's the overarching vision for the work that we do. It guides everything that we do, and that is education, advocacy, and coalition building. We really see this as an opportunity for us to lead the dialogue, advocate for change, and build a strong network of local grassroots support that is working to change the culture of breastfeeding in our state. And when we started in 2012, the first article on collective impact had really come out at about that time, and it was a real shift in the way that organizations, and especially nonprofits, but really cross-cutting sectors, were thinking about the way that we work together. And so since really the beginning of our formalization, we have adopted this collective impact structure and the 5 conditions of tongue-tied, 5 conditions of successful collective impact. And we've really adopted those and have made them the core central organizing principles in the work that we do. So I know that folks toss around the term of collective impact a lot, but I wanted to take the opportunity to really take you through the 5 conditions of collective impact to make sure that we're on the same page as we're talking through what this means. So the first is common agenda, and this is just at the top of your screen. So common agenda is this idea that we're all working toward the same thing. And so in the world of breastfeeding, obviously we're looking at breastfeeding rates, and many of you in the work that you do are thinking of it in terms of like normalization of breastfeeding, initiation and exclusivity, duration, but just making sure that we're improving breastfeeding outcomes. We have a shared measurement system, and so, and I mentioned some of the specific markers that we look at in terms of initiation and duration and exclusivity. We do mutually reinforcing activities. That's going to be a main part of what I talk about today when we're thinking about how we align and make more consistent the ways that we talk about breastfeeding, and just making sure that when we're working in communities in partnership, that the things that we do and say about breastfeeding are mutually reinforcing. And then we work for continuous communication, making sure that stakeholder groups are staying in contact one with another and staying aligned in the work that they do. And so with that, obviously we see ourselves as forming a backbone organization. We consider ourselves at the state level a backbone support organization for collective impact. So we really like the 5th condition. There's been a lot published about backbone organizations. I don't want to take you through all of it, but if you haven't read about backbone organizations and you do coalition work, it's really worthwhile to just Google collective impact and backbone organizations to understand the value of backbones and sort of the way that the writers of the collective impact framework really saw this component of it. So we really, in our role, I'll tell you, we serve as a neutral convener. And that's, again, part of that mission to lead the dialogue. We also work to mobilize funding. Right now, our focus is really on providing coordinated and easy to implement tools, fostering a culture of idea sharing and continuous communication, and helping local leaders to stop reinventing the wheel. We at the Michigan Breastfeeding Network kind of see ourselves as the backbone of backbones. This isn't really like a coin term or anything, but just this idea that the coalitions, the local coalitions within any community in the state of Michigan are also backbone organizations, and that we serve them. So we serve the backbone organizations in the local community. So we're the backbone of the backbone. And so that you can see, kind of get a visual of this, this is a map of Michigan, upper and lower peninsula, and it shows just with little pins kind of where the local coalitions are currently within the state of Michigan. We have 18 active and really robust local coalitions. Each of them is an independent and unique coalition. Some of them serve multiple counties and some serve just one county, but and they're very unique in the way that they're made up. Some are mother-led, some are WIC-led, some are hospital-led, some are more professional, some are more community-based. The structure varies, and they aren't necessarily dependent on the Michigan Breastfeeding Network for their existence. In fact, some of them actually were in existence prior to the Michigan Breastfeeding Network. So it's not as though we're sort of like an oversight body or anything, that we really are a support system to them, and they do their own independent work. And so I think that there's a lot of opportunity within that, in the sense that we have to really prove our value in order to be connected to the local coalitions, and it really pushes us to provide a unique set of services that isn't the same as the local coalitions, but that is a complement to the work that they're doing. We are working to grow our local coalition network. If this presentation had been last year, I would have said there were 15 coalitions. We actually had 3 new coalitions start this year. So it's really exciting that once we've really put some focus into building out the local coalition network in the state, we have had a lot of really quick uptake. There's a lot of interest in this work at the local level right now. So one of the first things that we did when we formalized in 2012, or shortly thereafter, was we were contracted by the W.K. Kellogg Foundation to do a landscape of breastfeeding support and actually provide for them an evaluation report about the state of breastfeeding in Michigan. And we were given instruction to go into 3 specific targeted communities within the state and talk to families and breastfeeding service providers, professionals and paraprofessionals, and learn what are the barriers to optimal breastfeeding outcomes in the state. And so we went to Flint, Grand Rapids, and Detroit, and we had focus groups, and we did surveys, and our surveys were in multiple languages, and we were in the WIC agencies and at the hospitals and with the home visitors, and got lots and lots and lots of feedback from families and from providers on what they thought were main barriers to breastfeeding support. And it was fascinating. I coincidentally happened to be project manager on this project, and it was fascinating to me, specifically in the focus groups, that in every single focus group, we had 6 different focus groups, and in every single focus group, somebody would say something to the effect of inconsistent messaging from breastfeeding stakeholders. And, they would use different terms, whatever, to describe it. But basically, this idea of messaging and the way we talk about breastfeeding not being consistent is a barrier to breastfeeding outcomes. And it was amazing to watch the room when someone would say that, because everybody else in the room would start nodding their heads or, moving their hands, or just sort of animate, and then the rest of the focus group in some way, shape, or form would have, would be colored by that, and we would continue talking about breastfeeding outcomes from the lens of how we need to make our messaging more consistent. This is clearly an issue that we have here in Michigan, but then as I've shared findings of this, and we've used this landscape support evaluation report and used it to talk with other leaders around the country. I'm sure at home and in your offices you all are kind of nodding too, that consistent messaging matters. When you're up against a formula can, right, if somebody's deciding whether or not they're going to breastfeed and they're hearing different pieces of advice and some of the things are conflicting, and then they look over at their formula can and it's all just right there and it's all measured out and it's described for them, it makes it such that when a mom is just wanting to make sure she's doing the best for her child and feeding her child or whatever, it creates a real barrier to feeling like they need to move forward with breastfeeding when they don't exactly know whose advice to follow and what that person wants or what that person means. So there's all this messaging out here, and it's, we need to find a way to bring the messaging together. And it's not enough to just all recognize it and say, yep, that's an issue, that's a problem, but we really need to come up with solutions. And as a state level, systems level partner, the Michigan Breastfeeding Network really took it upon ourselves to think through, okay, how do we align the messages and lead the dialogue in our state such that breastfeeding stakeholders are talking about breastfeeding in a way that moms hear it consistently. So, simple solution, right? We've got collective impact framework. We've got this problem of consistent messaging. Let's all just work together. Let's align our language. We're all set. Off to the races, right? Not so fast. So there's a reason that there's inconsistent messaging, right? And there's a reason that these silos exist. There's there's historical barriers, there's systemic barriers, there's just tens and tens of reasons why these happen. They didn't just pop up in all the counties around the state of Michigan and throughout the states around the country for no reason at all. So this idea that just because there's a framework in place and now and we also have identified our problem that we want to solve, it doesn't mean that we'll just sit together in a room and have this all be worked out without any effort. So we really have had to step back and think about, okay, so how do we get from knowing that we have this framework of collective impact and we have this consistent messaging problem that we want to solve, how do we get to a point where we get the people in the room and working on their consistent messaging? And so one of the things that I think is really fascinating when we talk about collective impact is, people at some level are familiar with the conditions, and the term itself is pretty intuitive, right? Like you can understand collective and you can understand impact and you can sort of sense what you mean when you say those terms together. But within that very first article, the authors actually bring out this concept of quick wins, and they talk about the importance of quick wins for sustained collective impact efforts. And I've noticed, and in talking with other people, that I think that there's a lot of people just glossing over this idea that a quick win is necessary. And so we've really stepped back and said, okay, we need to have quick wins in order to bring stakeholders together. So how do we make this happen? And I'm going to give you an example so you can kind of have an image in your mind as we talk through our other quick wins. So here's an easy quick win example that I can share with you. So this is a window cling from our Breastfeed Anytime Anywhere campaign. And Breastfeeding Anytime Anywhere, obviously this is a normalization campaign. And so these clings are free. They're available on our website. In a few slides, I'll actually give you some details on how to order them. But so they're free, they're available on our website. So let's, hypothetically, let's bring together a coalition, okay? So maybe you'll have like a hospital nurse manager, maybe you'll have a WIC agency coordinator and then a WIC peer counselor. You'll have maybe a few home visitors, you'll have some moms, maybe you'll have a mother in your community that leads a Facebook group that talks through breastfeeding. So you'll have this whole group of people and you'll get them together and they'll know that they want to be a coalition and they'll know that they want to do collective impact work, right? That they want to change the systems that mothers find themselves in when they go to breastfeed their children. And but they won't exactly know what to do, right? There's power structures in place, there's power dynamics in place, there's different levels of the organizations represented, different different experiences that people are bringing, and they don't really know how to even out the way that they talk to one another and have everybody bring their best strengths. Well, here you go. You order some clings off the website, they arrive for free, and as a group, the team goes out and maybe they each commit to hanging one on their car, and then they go to the local coffee shop and they go to the local library and maybe one other business and convince each of these entities, maybe let's say a local church, they convince each of these entities to put a cling up, all right? That in and of itself, that act of just getting those clings distributed and hung in their community and pushing the needle just a little bit further on normalization, we've shown or have found that is really powerful to helping those folks that are, not kind of unlikely partners suddenly feel like this is a real partnership, and that they actually, okay, so we tackled that one. That was easy. It was actually kind of fun, and I'm maybe as a nurse manager, I'm not used to talking to coffee shop owners, but hey, I did it. I stepped out of my shell and it was kind of exciting. And now I'm high-fiving a breastfeeding peer counselor from the WIC agency. And, you're kind of having this moment of, wow, we did that. Hey, let's tackle something bigger and better. And that really is a catalyst for some of these larger scale collective impact efforts. So when we think about the systems that we aim to improve within the Michigan Breastfeeding Network as a statewide coalition, we're looking to impact healthcare systems, education systems, childcare, religious, social, political, et cetera, all of them, right? Because when you look at breastfeeding outcomes, we don't actually have a perfect system anywhere yet. We're getting there, with the Baby Friendly Hospital Initiative. We are moving in the right direction with our hospitals, but it's not as though throughout the country there's any one system that is just perfectly doing things for breastfeeding families. So there's a lot of work to be done, right? And so with that, if we take this idea, you can really tackle whatever you're interested in, and you bring the lens of collective impact. You think about it through a consistent, quick win, sustainable message, and you can actually pretty much get to work. So I'm going to take you through 3 of what we call our project portfolios at the Michigan Breastfeeding Network and share with you quick wins that are associated with each of them. And just so you know, I'm not going to dive in necessarily to the broader collective impact efforts that happen after the quick wins. That's something that if you're interested, just because this is a short presentation, but if you're interested in talking about that afterwards, that's something that we can talk through. And also, I'm going to give you links to our website to dive in more deeply as well. So the first I'm going to talk to you about is our 310 Connect. All right. So 310 Connect is we know for initiation and exclusivity, the hospital and the community impact everything when it comes to moms actually planning to breastfeed and understanding breastfeeding and being prepared to go into the hospital and ready to breastfeed. So within our 310 projects, and we have several of them, we partner with Cofective and the Michigan WIC division on everything. Cofective has been an incredible partner since the very beginning as a real leader in as an organization that lives the message of collective impact, but then also kind of pushing us forward and also connecting with other communities in other states and sharing lessons learned from what's happening in other places with us. And then the Michigan WIC division, I think it's kind of obvious, but in Michigan, WIC touches 53% of all families and all infants in Michigan. And so if you're looking to impact breastfeeding outcomes, WIC is already a leader in breastfeeding. WIC is a natural partner, and WIC itself is also doing initiatives with Cofective that are in some ways related to our 310 Connect projects specifically, but then in other ways just aligned with them. So 310, what does 310 come from? Well, it comes from the Baby Friendly Hospital Initiative, and this idea that step 3 is prenatal preparation for the hospital, and then step 10 is connection to community support groups and other community resources upon discharge from the hospital. So as a community-wide, a state-level partner, we really can impact uptake of the Baby Friendly Hospital Initiative by helping entire communities own steps 3 and 10 and not just put all the onus on the hospital, right? So we have initiatives within 310 Connect that are statewide, community-wide, and within the hospital system. Currently statewide, we're doing the WIC statewide initiative. We're in our 2nd year of this, where we're working with the prenatal clinics and the hospitals. We have 2 community-wide initiatives right now, one in Battle Creek, Michigan, and the other in Flint, Michigan. And then within the hospital system, we actually have a 10-hospital collaborative that we're working with hospitals to implement the 10 steps and moved in the direction of baby-friendly designation. So some of the quick wins that you can think about when, whether somebody's really in it to win it with us and they're part of, these deeper dive initiatives that we have going, or just there's opportunities for them around to implement this without being part of one of our wider initiatives, there's 3 things that you can think of within the Cofective system that really offer up quick wins. I'm going to start bottom right. The easiest and fastest is probably the mobile app, right? That's the handout of the 21st century. And probably at this point, many of you have already downloaded the Cofective free mobile app. If you haven't, please take a moment to do so you can see it. One of the things that we talk about in all of our stuff is how, generationally women haven't seen breasts for their normal purpose. They haven't seen normal breastfeeding. And one of the things that I love so much about the Cofective app is that mothers and champions can get lost in the images. They can just, swipe and swipe and swipe and just continue seeing images of normal skin to skin, normal rooming in, normal breastfeeding. And so it's a great resource and it's free. So a quick win, let's say for a breastfeeding peer counselor, is telling mom to download the app, so that by the time she gets to the hospital, and maybe the hospital has maybe implemented this, the motivation document, which is the handout that's right above the app on your screen, maybe the hospital shows her that, and the hospital person or the mom says, oh yeah, I've already seen that stuff because I have the app on my phone. That's a win for the WIC agency. It's a win for the mom. It's a win for the hospital, because then the hospital's feeling like, oh gosh, this is going to be easy. Like, this person already knows a lot of these things and is going to be prepared for these practices. So the WIC in Michigan actually offers all community partners who'd like them free copies of the professionally printed, I should say, copies of the motivation document and the We're Prepared checklist. The prepared checklist is actually the one to the left, which is again, reiterating those same practices and concepts or categories of practices, just in a different way. And so you can order these, or have them. They're free, available online. But in Michigan, we specifically also get them through our WIC agencies if they're not in another initiative. And so there's this just idea of, I can do the thing that works for me, and you can do the thing that works for you. And it's helping all of us to use the same messages without necessarily having to make a big investment in a broader, practice change initiative. So if you'd like to learn more about what we're doing with our 310 Connect, check out our website. This is the direct URL to get you there, mybreastfeeding.org/310connect, and you can see on the left there's a whole bunch of information about how we do this work, in a deeper way, above and beyond these quick wins that are available to anybody throughout the state. The next one is our work together, and WORK stands for Working to Overcome Roadblocks. And so this really deals with extending breastfeeding and helping moms and families to reach their breastfeeding duration goals. So this all started actually with our workplace project. We've just actually moved into year 3 of our CDC 1305 workplace project. But now, because of the work that we were doing in the communities and some of the feedback that we've gotten, we've actually learned of other, what we call duration roadblocks or duration busters. And so we've expanded our work just recently into jury duty, incarceration, child custody, child care, and medication and acute illness. So we actually have we're working on developing a train-the-trainer model with that. So with these duration busters, what was happening was coalitions and moms were approaching Michigan Breastfeeding Network, and they were frantic. And I'm not kidding. I mean, it's really frantic, because mom has, breastfeeding is established and she's on her way and things are going great. And then all of a sudden there's this thing, this urgent thing that came up that makes it so that she may or may not meet her goals. And what we were finding was that providing at the state level, providing one-off solutions was really inefficient. And in many cases, the solutions are fairly consistent. So as a state level partner, what we realized is, we could be providing consistent solutions across the board, reduce the amount of work that needs to be done, and make it so that we aren't necessarily the gatekeeper of this knowledge, but that the local coalitions are empowered to provide this knowledge. We can house it on our website. Again, thinking about us as a backbone, what can we do? We can house it on our website. We can develop this train-the-trainer model to help local leaders feel like they know how to speak to these issues and know what to do. But then really put it back in their court and help them to be the local expert and local resource to moms in need. So a few of the quick wins, I'm going to speak specifically to our workplace project because that's the one that we've done the most on so far. The other ones are more in development. But we have 2. One is the Michigan Breastfeeding Friendly Workplace Awards, and we are in our 2nd year of doing this project. We've awarded 25 businesses so far. And this is really fast and easy. And what we've ended up having happen is with our local coalitions, they identify businesses in their community and then reach out to a mom who has had success breastfeeding in the community and get her to nominate her employee. And this is a really great way to tie a mom in. It helps her to, or I'm sorry, her employer. It helps her to really be empowered to recognize her employer. It makes her look good with her employer because she's recognizing them for an award, and it's showing some gratitude for the things that they've done to support her. And then it also connects the employer to the coalition. We offer 3 levels of award. We offer bronze, silver, and gold level awards. And the bronze is really, are you in compliance? Silver is a little bit above and beyond that. And then gold is kind of the gold standard of employers with, consistent policies and maternity paid leave and things like that. And so what we found is like the bronze employer and the silver employer are like, well, what would it take to get to gold? And it's like, well, we got you, let's do this, So there's a real opportunity created just by this 5-minute application that the employee fills out, that then you can move them towards, really more ideal employer status. So it engages them in the longer term. And then the door hangers is another one that's been fun and easy. We offer these for free on our website. You can order them. And we encourage like HR professionals to have them on hand, with peer counselors, or whoever is dealing directly with moms who are going back to work and are concerned about pumping at work. We offer these door hangers as an opportunity for them to give something to the mom that creates space for her to take the time that she needs in accordance with the ACA. And so we've really enjoyed using these because we found that this is a window to getting that HR professional to be thinking about, if she has a quick win or he has a quick win of distributing these door hangers, it's a nice opportunity for them to say, hey, I've distributed a few door hangers to to their boss or whatever. Can we do a little more? Like, clearly there's a need here. Could we do more? So it creates a real window of opportunity for longer term and deeper engagement. If you want to learn more about our workplace project, we don't actually have the other duration buster or roadblocks up yet on our website. We're doing a revamp, but if you want to learn specifically about our workplace project, please check out our website. There's a whole lot more there and more resources for you to see. The last one I'm going to take you through is really our normalization one. This is based on a 2014 legislative victory that the Michigan Breastfeeding Network had when we were a much younger organization, where the Michigan State Legislature passed the breastfeeding anti-discrimination law that made it so that a woman could breastfeed anytime, anywhere, and it made it enforceable that she would receive the same services as someone who wasn't breastfeeding. So it's no longer permissible in Michigan that somebody maybe not be served at a restaurant because they're nursing, or that they be told to go to a separate place in order to breastfeed. Breastfeeding is welcome anytime, anywhere in the state. And so we've got the law on our sides now, but this is really a campaign to make it so that this is the norm also. Culturally. So this was designed using the CDC strategy number 8 that is in their breastfeeding and their breastfeeding strategies document, and it's really around social marketing and how do we use social marketing to normalize breastfeeding. And this project is probably the one that's the biggest, most chock full of quick wins, and it's easy to fold into existing coalition work. When you think about your local coalitions, many times they're already doing the work of normalization, and so getting them to jump on to a normalization campaign is sometimes easier than one of these duration or initiation and exclusivity campaigns. So we found that this Anytime Anywhere campaign, while it's probably our simplest and the most full of just the quick wins and not necessarily the meatier stuff, it creates a real window into the longer term and larger scale engagement with our workplace and our toolkits and our 310 Connect and our WIC statewide, all of those initiatives. So we offer clings and pledge with a QR code and a Know Your Rights card and an advocacy toolkit with that one. And so here's the quick wins that you can see with that one. So the one on the left is actually, it's a business card. We offer these for free on our website. We encourage people to just, again, kind of like the door hangers, have a stack of these and give them out to moms who maybe feel like the mom would breastfeed at home, but then not when she goes out. And, you all know the implications for supply if a mom is not able to feed on cue. And so this is a card that can help a woman who maybe wouldn't necessarily be comfortable breastfeeding in public if she wasn't totally clear on what her rights were. And so, you know, in many cases, a mom's never going to use this, but you give it to her and she puts it in her wallet, and it goes in her diaper bag, and she has it with her when she's nursing in public, and it helps her to feel like, okay, if someone were to say something, I know my rights. And so we give these out, I'm not kidding, like by the hundreds, because people are like, yes, that's something that really, you know, that's a quick win for me and my families. And it has the language of the law on there. We also do this pledge. We offer the pledge. The pledge is like the least controversial thing you can imagine. It basically says we support breastfeeding and we acknowledge a woman's right to breastfeed anywhere, anytime, anywhere. It's just a couple of sentences. But this is a real quick win for larger organizations to sign the pledge. I actually graduated from Michigan State University, and I'm a very proud Spartan to say that MSU signed the pledge, and they had a cake after they signed it within their work-life office. They were so excited to have signed on to this because it's a statement about what, you know, the culture of the organization and the way that they feel about breastfeeding. And so we've had churches sign, we've had breweries sign, we've had a few libraries, lots and lots of individuals. We post them on our website, but it just creates this culture of community around supporting breastfeeding. And we offer a QR code for coalitions who want to take that to, you know, with their exhibits or whatever. We also encourage our coalitions to just use this tagline, breastfeed anytime, anywhere, in the stuff that they do. They don't even necessarily need to use the materials, but just use the tagline. And then the other one I shared with you earlier about the clings, but you can see it here on a car. And then we have, it's called the Click with Cling contest. We have the hashtag Click with Cling. And if people take a picture of where they've posted the cling, then we do a drawing for them to win a gift card. And we do that quarterly. So it's just this idea of like finding ways to get this message and get the idea of breastfeeding happens anytime, anywhere into the lexicon of Michiganders. You know, we'll really feel success in this program when, you know, people at Detroit Tigers games, when, you know, are thinking about breastfeeding anytime, anywhere. So it's a multifaceted project. And you can see here, we have the website again, mibreastfeeding.org/anytime-anywhere. You can, on the left-hand column, those are all the action points that you can take in association with this campaign. So many of you, maybe you've heard of BJ Fogg. This was something that came out with our partnership with Cofective because his work has really informed the creation of their tools. And so he has this model of behavior change that we've really found is very easy to implement in, you know, in thinking about quick wins. And what he says is get specific, make it easy, and trigger behavior. And so if you have those three things in mind when you're, you know, working on your tools or, you know, developing your own quick wins, we found that really, when we develop all of our stuff through the lens of get specific, make it easy, and trigger a behavior, we have a lot more implementation of these, or use of these tools. So some of the things that we developed are pretty prescriptive, and some are just starting points. You know, like giving somebody a cling, they really choose what to do with it. But then when it comes to things like the We're Prepared checklist, or, you know, some of the other tools that we have, or how to fill out a workplace award application, like that's a pretty thought out solution. And so one of the things that's really important is that the ask has to be clear, and we have to have a continuous feedback loop with our local stakeholders. So I shared earlier that we do this quality improvement collaborative under the umbrella of our 310 Connect projects with hospitals. Within that, one of the things that we do is we teach them about PDSAs, and that's the Quality Improvement Strategy of Plan, Do, Study, Act. And what we found with that is that we really need to model what we teach others, right? And so within each of our projects, we also do a Plan, Do, Study, Act. We're constantly gathering feedback from the people who are working towards the same goals that we are, these goals of initiation, exclusivity, normalization, and duration, and then also actually using our tools. And we learn from them what are some of the things that they liked, what they didn't like, how we can model them, how we can change them. I'll share with you that the Anytime Anywhere project started out as clings. That was it. It was one little tool. And within a year, we then learned from other people about, well, what about having a card? And what about having an advocacy toolkit? And how about, you know, what if you were to do a pledge that people could sign on to? And it just very organically grew into a pretty robust project. And that's all because of the PDSA model that we have ongoing with our local stakeholders. And another thing to make very clear is that all of our success is built on other success. It's built on the success of our partners. So if you are in Kansas, Missouri, Louisiana, or Indiana, you probably recognized a lot of the tools that I shared with you previously on these quick wins, because they're tools that we learned about through conversations and communications with your leadership. So, you know, you're a really impressive group, all of you out there, and we're really proud to be your partners. We're proud to, you know, borrow and expand on your ideas. And, you know, one of the first things that we do whenever we start a new project is call up our partners at USBC and ask them, hey, what are other states that are doing something in relation to X project? Let's say workplace, for example, and then they'll tell us, you know, who they've worked with and who they've heard of and, you know, what they know of, and then that really moves us in a direction of informational interviewing to learn about successes and opportunities within other organizations. So for example, with our door hangers, that actually is directly from the Kansas Breastfeeding Coalition, and we actually credit the Kansas Breastfeeding Coalition at the bottom of the door hangers. That was a conversation with Brenda Bandy, and she shared with us the work that they were doing very generously, right? And so instead of reinventing the wheel, we were able to just tailor the things that they had done, align it with our, you know, the work that we're doing, include the messages that we needed to include, and publish it for our folks. And we offer the same opportunity for our local coalitions, that if they want to customize it even more, then they have that power to do so. The Anytime Anywhere campaign was through a conversation with the Louisiana Breastfeeding Coalition, and Marcy, who has been just invaluable partner. When we were describing to her the clings and the Know Your Rights cards, she said, well, that sounds kind of familiar to our Breastfeeding Welcome Here campaign that we're doing in Michigan or in Louisiana. Do you all have like an advocate toolkit? And we said, no. Can you share with us? And she said, sure. If you change it, you know, let us know. We want to see it. So we took it and we added in the breastfeeding anti-discrimination law language from Michigan. We added in our specific QR code, and, you know, we tailored it, made it our own. But again, you can see we've credited the LBC with this because really this is just building on the foundation that they put forward. And then lastly, I'll share with you, there's many more examples, but I'll share this one with you too. So the other one is our Great Lakes Network Breastfeeding Series. So we have a new education series that we actually just started in July, and that came directly from the Indiana Perinatal Network. They put in amazing foundational work to build up this monthly series, and then the Michigan Department of Health and Human Services joined on, and it was growing, and when they needed a new implementation partner to take on the series, we already were partnering with them on this work anyway. I said, you know, can you take it on? And we have, and so we really took, you know, they provided us tons of information about the logistics and how they handled it and things, you know, what speakers they were using and the work that they were doing. And then we built on that so that when we took it on last month, we really started from the foundation that they had built. So this is an open invitation. We really want to do the same thing for all of you. It's, you know, we really view it as we need to pay it forward. We've been so fortunate to have these partnerships with these other statewide partners. If you are at all interested in the work that I just shared with you, please know that we want to be as generous with you as the, you know, our partners have been with us. And we are, you know, currently sharing, but I just want to make very, very clear that we're here and we would be excited to support you. So that said, it's not all, you know, sunshine, lollipops, and rainbows, right? Like there are some things that we could, and we are moving in a direction of making stronger. So we have real opportunities, and I'm going to share 4 with you today. The first is, and this is an exciting opportunity actually, this is that we have grown to the point now that we have a lot of incoming requests, a lot of incoming information, and also our network has grown and has expanded so much that we really need to cultivate message ambassadors. We aren't necessarily going to grow our staff or our board at the same rate as the message and the coalition infrastructure has grown, and so we have this opportunity right now to really help more people understand our main overarching goals and the main you know, projects and the, you know, the direction we're going, and empower them within their own communities. And I'm, you know, specifically thinking of local coalition leaders and mothers and, you know, people in the community who can take this message and advance it. And so, you know, for like sharing on social media, or, you know, taking the newsletter to their coalition meetings, or, you know, any of these things, but these message ambassadors who can take the message of normal breastfeeding and keep the language consistent, but take it out to a broader audience than we would ever be able to. Another one is there's a real balance that we need to strike between solving the problems that are out there versus empowering the local communities to do this. And I think, an easy example of one that can just be solved is in duration busters, jury duty, right? So in Michigan, all you have to do is have a letter from a physician or a lactation consultant or a nurse midwife that says that you are actively breastfeeding and not able to show for jury duty. So it would be silly to try to empower every single person that needs one of these to draft their own letter for their physician to sign, right? We can take out that work. We can draft a letter for, and put in the necessary template stuff so that people know how to customize it, make it their own, and sign it very quickly. That takes away work for many people and frees them up to do bigger, more exciting things, right? So that's one place where a solution makes sense and we have a solution ready. But in some of these more complex things like the workplace initiative and some, like the 310 or maybe child custody or some of these other, there really is a balance to strike between knowing that there's an issue and having some quick wins to catalyze broader solutions, but not solving it because that chops off the creativity of the local entities, the local leadership. And we really want to make sure that we're creating a culture where creative people can come together and do bigger, brighter, better things because they're together, in a collective impact framework. So it's a balance. Another one is just educating versus overwhelming. There's like this constant balance between how much information do I give someone so that they're not held up versus how much do I tell them that we're doing to the point that they're like, oh, I don't follow. Like, I'm shorting out. I can't do this. I don't know what you're doing, and I don't know how to get started, right? And so there's this constant need, and we're working on developing kind of operationalizing this and also just being really cognizant of it as we go into communities, of understanding the difference between educating them to the point that they can do above and beyond what they would have done versus stagnating them because we've overwhelmed them with too much information. And then another one is just this need to, stabilize what's happening versus expanding. We have a ton of incoming opportunities, but there's also existing structures, right? And there's a reason that those structures are in place. And so we need to understand and validate and, give appropriate recognition to the structures that are in place and work within them, but also, really expand the work, diversify the work, and make sure that we're bringing new partners to the table and creating new opportunities and not, saying no because when we want to say yes because, the need is there. So it's just this balance between, stabilizing and growing the work that we're doing. So that said, like I said, this is just a very small taste of the things that we're working on. I hope that we have an opportunity to really continue the conversation. I want to say thank you so much for having me today. Like I said, it's really an honor to have gotten the opportunity to speak with all of you. And I'm hopeful that some questions have come out of this. I can answer a few today. And then please take my information and reach out to me directly if you'd like to continue the conversation or you think of something at a later date. And Danae, I'll pass it back to you.
Excellent. Thank you so much, Shannon. Such amazing information and application of collective impact. We do have a few questions. The first one is, you mentioned the WKKF project funding. What other sources of funding do you have to support all of the graphic design, the printing, all of the projects? Can you talk a little bit more about that?
Yeah, so we really do work on a model of very diverse funding sources. So our state health department has been an amazing partner, and we actually work, we have funding from 3 different entities within the health department. So we work with WIC and also the obesity prevention folks, and then also the maternal infant health folks. And they all work together, and they're partners, and they're aware of the different funding streams. But we do that because different areas are touched more specifically by different people. And then we also have continued to work with the Kellogg Foundation. We work when we're in specific communities. It's been important to us to find funding from that specific community. So like our Flint project is funded by a Flint funder. And then there's just a few other foundations around the state that we've gone to. I think that you have to apply to a lot of different places in order to get funding, so don't give up. But I think for every 3-4 applications you put in, you get 1 funded or something. I don't remember what the number is, the statistic is, but you have to go and apply a lot of different places, and stay persistent. If you believe in the work that you're doing, just keep looking for an organization that is able to fund it.
Wonderful. Another question came in. Do you know whether the public school system in Michigan are breastfeeding friendly workplaces? And is there any coalition initiative devoted to increasing support there?
I love that question. Thank you to whoever asked it. So there's a few ways to think about this. So I think that the straight easiest answer is to say no, that we don't have it where like the entire public school system is, but we are creating a race to the top. And I'm really, really excited that Michigan State University has, they applied for a workplace award. They've signed our Anytime, Anywhere pledge, and they are willing to be a model for the university systems. Go green. I think that's awesome. And then we also have a couple of public school local systems that have applied for workplace awards, so we are able to use them. Like we have a high school that's applied, an elementary school that's applied, and so we're able to use them as examples. And how so when people say, oh, I'm a teacher, my employer doesn't have to be in compliance with the law or whatever, we're able to show that there are employers that are in compliance with the law, and this is how they do it, how they make it work. So we don't have an overarching policy, but on the other hand, we are making significant headway on that one.
Awesome. Thanks so much, Shannon. Another question is, is Michigan doing any work on the issue of some mothers exclusively pumping from birth without medical need? There seems to be some confusion the actor comes across about breast milk versus the process of breastfeeding and its increased benefits over pumping alone.
Yes, so within each of our projects, we actually do speak to that. So like, for example, when you're thinking of the 310 Connect stuff, there's the Protect, within Cofective System, they have the Protect counseling sheet and information on the app, whatever. There's the category called Protect, and that's all about not introducing bottles or nipples until breastfeeding is established. So that's one example. And then within workplace, we talk about pumping a lot, right? Because you're thinking about going back to work, but then we also are pushing this idea of if there are ways to have a more accommodating environment, maybe like the baby can come into work or mom can leave for short periods of time if she works nearby, or having a daycare on site. Like, we definitely share that as an as a way to think about accommodating that. And then I would say, this is a major issue. This is a thing that we talk about a lot. One of the things that came back with our PDSA cycle on the Anytime, Anywhere campaign is the question of, a woman is able to breastfeed anytime, anywhere in Michigan, but is she able to pump anytime, anywhere in Michigan? And, so we get questions like that because, pumping has increased a lot. And so we speak to the medical or the evidence base that says, first best is milk from the mother's breast. Second best is the mother's milk expressed. So we speak to that in all the work that we do, but then we also are just pragmatically aware of the fact that, we do want second best more than not, right? So we are working to find ways to make sure that our pumping moms are also acknowledged within each of the things that we do.
Great. And I think we have time for maybe 1 or 2 more questions. So first, can people from outside of Michigan order your resources, and how do they go about doing that?
A great question. So yes, you may. They are definitely designed for Michiganders. They say Michigan Breastfeeding Network all over them, and they like the Anytime, Anywhere campaign actually says Michigan Breastfeeding Network, the logo and the website on it. So it's not that you would necessarily want them. If you're interested in like a sample so that you can show it maybe to your supervisor or, kind of that sort of thing, you can email directly and I can get you, I can just send you one. And also, if you're interested in the files, like I said, like reach out. We are very interested in supporting other organizations, especially if you'll, tell us how you use them and sort of, how you improved upon what we've done.
Awesome. Thank you so much, Shannon. This was an amazing presentation. I know I learned a lot. And we know that the vital work that we do is all about partnerships, coordination, and collaboration. And it's truly amazing what we can accomplish together to impact the landscape of breastfeeding support. So thank you so much for that presentation.
Thank you.
All right. So we're just going to move into a few updates. So the USBC just held the 7th National Breastfeeding Coalition's convening, and we had some data shared by Kriya Perrin from the 2015-2016 National Immunization Survey analysis. So that data has been released, and the survey found that among babies born in 2014, the percentage that were ever breastfed was 82.5%, and this exceeds the Healthy People 2020 target of 81.9%. So that is truly amazing progress. And while this progress is very heartening, we do know that there's still more work to do to address racial disparities in breastfeeding rates. And a recent DNPA study did find that racial gaps persist in breastfeeding initiation, exclusivity through 6 months, and duration at 12 months among Black and white infants born in 2010, between 2010 and 2013. So we still have more work to do, but what an amazing accomplishment from you all. The second update I would like to give comes from USBC. As you may know, both houses of Congress will have returned to their home districts by August 11th. So we are looking for supporters to make in-district recess visits during the remainder of National Breastfeeding Month. So to prepare you for those in-district meetings, the USBC will be hosting a virtual briefing webinar this Thursday, August 10th from 2 to 3 p.m. Eastern Time. The link should be active in your slides, and I will also chat it as well. Sarah, if you could chat that link for us, that'd be awesome, so that people can register, but it's also available in the slides if you just click on the virtual briefing webinar. It should take you to the registration. And again, that is this Thursday, August 10th on GoToWebinar. All right, well, that brings us to the end of today's session. We hope very much that the 222 webinar is bringing you ideas for collaborative action. So we ask that you please complete the webinar evaluation and let us know how we're doing. Your suggestions are valued, and it really does help us bring you webinar topics that are most relevant to you. You also get a downloadable certificate of attendance when you complete the evaluation. So a little bribery there to do it. And again, many thanks to Shannon and to all of you for all you do to improve the lives of women, children, and families. Goodbye for now, and I look forward to having you all for our next webinar. Until next time, thank you.